Hi friends, welcome back to my channel Sharing Simple Knowledge. This is a requested video. One of my viewers has requested me to do an explanation for this case note. So let's see how we can do that. So first of all you have to check your position. Register nurse on the cardiology unit at St. Jude's Hospital where Mr. Ox was admitted after a heart attack. So the patient was admitted with a heart attack. The patient name Mr. Samuel Ox, age 44 years. Admission date is given 10th January 2014 and discharge date is 13th January 2014. So only it is 3 days process. So then it has mentioned about the allergies, aspirin and penicillin. So what are his presenting problem? Myocardial infarction on 10th January, sudden crushing chest pain brought in by ambulance from work. Then before we proceed to the past medical problems, let's see to whom we are going to write it. So what is our writing task? Using the information given in the case notes, write a referral letter to. So this is a referral letter to the nurse in charge, Miss Petra McGovern, at the Cardiac Rehabilitation Clinic, St. Jude's Hospital, 56 Chelmsford Street, Newtown, News W2376 for cardiac rehabilitation. So we got an idea. We are going to write the letter to cardiac rehab nurse, and so first of all we have to imagine ourselves as cardiac rehab nurse, then think what all relevant information we have to include. During analysis you have to think about this clearly and only include the relevant information for a cardiac nurse. The other relevant information should not be included in this letter. So let's move on to the past medical problems. Weight gain over past 5 years, now mildly obese. The weight is mentioned clearly 90 kg. Then hypertension, takes antihypertensives. Then he has family history of heart disease. Mother had hepatitis, died at young age. Repair of inguinal hernia at age 20. Deaf in left ear, wears hearing aid. Then it is mentioned with social history. He has high stress job, executive at IT company. He then, as you know, due to high stress, he doesn't have time to eat healthy foods. That's why it's mentioned he stays poor diet. He always takes the food from outside, and the high fat intake. Then moderate to high alcohol intake. Socialize with work colleagues 2 to 3 times per week. Is a non-smoker and he do intermittent exercise. He tends to join a gym for a month, then quits. So that's what you understood from this one. So he's not compliant with exercise because he's not following regularly or anything. He's just doing in between. There is no continuation. That's why he's not compliant with his exercise program. So from these histories, what all information you have to include, you can put a tick mark. Just check. The other information which you don't want, just cross out. So it will be easy for you to analyze and make an organization later. Okay. Then let's check what are the treatment they have provided and what all findings they have found during hospitalization. So on 10-1, on assessment, blood taken for cardiac markers and ECG has done, which was aortic elevation. So therefore he has undergone coronary angioplasty with IO stent. This is the name of a stent, IO stent. So the cardiac nurse, she's aware about this one. Then again blood taken and the high cholesterol levels identified. Patient worried about taking statins. What is statins? Statin is our medication which is we are providing for the high cholesterol. For example, atorvastatin, that is the Lipitor, and simvastatin, that's the Zocor. Then next day he has commenced means started on anticoagulant daily. That is clopidogrel. The name for clopidogrel is Plavix because he's allergic to aspirin. That's why they started on clopidogrel. Then he agreed to commence simvastatin 40 mg daily. Initially he was so worried about taking statins, but he agreed now. And the chest pain relieved by GTN spray. That is, what is GTN spray? That is glycerol trinitrate. We usually use to for the angina or the chest pain, to relieve the chest pain we are giving. So it has relieved, and ECG repeated, which is no extension of MI. So it means he's improving. His condition is improving. So 13th one, that is the discharge date which is mentioned, nil chest pain. So he has no chest pain now, and observation the vitals, everything is stable, BP stabilizing because he is hypertensive and he's on medications. Then consult with hospital dietitian regarding weight loss program. So already we has contacted the dietitian regarding weight loss program because it's all related to cardiac problem, the hypertension and morbid obesity like this. So how to control everything. Then let's see what are the discharge plan. Cardiac rehab for post MI education, especially statins. Encourage patient to keep taking statins. Need to understand side effects and interactions. Example, grapefruit. Because we know there are some medication which interact with some medication or any food items. So we should be careful and we should instruct the patient regarding the interactions. So then check the BP weekly, report increased BP. So if it's hypertensive, there is a high chance for cardiac problems. So we have to control the BP. Then cardiac rehab, develop cardiac exercise program, monitor compliance with the program. Because it was already mentioned that he is not compliant with the exercise program. He is reluctant to do the exercise. Then encourage adherence to weight loss program. Adherence means again the compliance and also to follow the weight loss program. Weekly weight checking until follow up at cardiac clinic. So the cardiac clinic appointment is after 6 weeks and to be sent to patient. So these are the recommendation. So one of the important informations I would like to provide is that if your discharge plan is so long and there are a lot of informations to include, what you can do, don't write all in the discharge plan. You can take some of the one which is we can be connected in the hospitalization time management and which needs to be continued like that. At that time we can include. So the recommendation will not be so long, and if it is so long the reader might get irritated and he does not want to read that one. So it's better to include in the previous the notes. So it will be well connected and also it's easy to read and it looks legible as well. Okay, then if other information I would like to provide is that if there is some medication which needs to be continued like that, no need to write the patient has started on commenced on per simvastatin and it needs to be continued. We can just write the patient has has been commenced on. So it is means that should be that time also we are continuing, so needs to be continued, so it has finished, so it will concise the letter. So let's see how we can write this letter. So we are going to write Miss Petra McGovern. Who is she? Nurse in charge. Always write the position of the receiver. Then we can write the cardiac rehabilitation clinic, St. George's Hospital. That's enough. At least 4 sentences is enough. Then the discharge date, which is the discharge date 13th January 2014. You can write in two ways like this, 13 January 2014 or 13 slash 01 slash 2014, like that also you can write. Then the salutation, dear Miss McGovern, usually use the surname. And the reference, Mr. Samuel Oaks, 44, age, comma, age 44. So always think about the gender, do not interchange, because when we are writing and once we reach the second paragraph, maybe we by mistake we write Mr. to Mrs. and if it's Mr. we can write she or he, it can be interchanged, so there is a chance to lose the marks. So always do the proofreading once you finish the writing, so you can correct immediately and you will not lose the mark in that section. Okay. And also the grammar, if it's singular always use has, is, like that, and if it is plural you have to use are, where, like that, and also the grammar. So the proofreading is a must in the writing section. Okay, so let's see how we can write the introduction. And another thing is that if the patient has undergone any procedure or any surgery and if he is recovering from that one, it's better to mention that one instead of diagnosis in the introduction, so the reader will get a clear picture if the procedure has finished. So, and if you read at last, it will not be effective for him. So if he knows early, it will be easy for to understand the condition of the patient. Okay, so the introduction, it was mentioned that this is a referral letter in the writing task itself, so it is easy for you to understand. Is it a discharge letter, referral letter, transfer letter, like that. Okay, so I am writing to refer Mr. Samuel Oaks, who has recently undergone coronary angioplasty. What is his requirement? He requires, so angioplasty, then we can put comma, requires cardiac rehabilitative care and management. Then the current situation, how the presenting complaints. Mr. Ox, comma, who is hypertensive. So no need to mention about the hypertension, the medical history. So it's easy and we can concise the letter. Who is hypertensive was brought to hospital on 10th January 2014. Always make sure you are not writing brought to hospital or hospitalized, like that. Don't write brought to the hospital. If the name home of the hospital is specifically mentioned or something like that, we can use the otherwise don't use. Then presented to hospital. If it's emergency department, like that, we can write presented to the emergency department. Then here was brought to hospital on when 10th January 2014. What was his complaints? With definitive symptoms of myocardial infarction. We know these all are the definitive symptoms because this is already diagnosed and he has undergone the procedure as well. Then if it is only suggestive symptoms means It's only suspected. We are not quite sure. It's not a diagnosis means we can write it. Suggestive symptoms of myocardial infarction. Then what he is on assessment, his ECG showed ST segment elevation. Consequently, the procedure was performed in which a stent was inserted. So, what happened in the hospital? On the following days, and also one more thing is that we have already mentioned in the introduction coronary angioplasty. So, don't repeat it again in the next paragraph. That's why we use the procedure was performed. On the following days, Mr. Oak's cholesterol levels were found to be elevated. Then, although he agreed to commence on simvastatin, he's still worried about its intake. He's worried about taking statins. So, no need to write again statin or simvastatin. We can use its intake. Therefore, what we need? He's still worried. We need, therefore, he needs. Or we can write passive voice. Therefore, education on side effects and interactions would be highly beneficial for him. You always make sure you are using both active and passive voice. And if it's when you use passive voice and it's when we read it doesn't look good, means you can use active voice as well. Then he has been prescribed clopidogrel as he is allergic to aspirin. So it is finished here itself. Then currently Mr. Oak's condition has improved. So that paragraph was finished. Then we can write the social history. Mr. Oakes is mildly obese and his current weight is 90 kg, for which he has been initiated weight loss program. Then only that much history we need to include. Then the recommendation. It would be greatly appreciated if you could encourage the strokes to keep taking statins, because it's mentioned that it has to be continued. Encourage patient to keep taking statins. Then what else we have to mention? Please check his blood pressure weekly and report if high. Then we can use the words like it is important to monitor, it is highly recommended, please encourage him, please note that, kindly note that. Always try to write it in a polite way. Don't make it doesn't look like ordering or commanding. It should be always polite. So it is important to monitor his compliance with the cardiac exercise and weight reduction programs. We can connect it together. No need to write it separately. Then what else we have to mention? Kindly assess his weight weekly until his next appointment at cardiac clinic after 6 weeks. See, you are connected these informations together in a single sentence. That is the way we are concising the letter. Okay, I think it's clear for you. And we can mention also, please note he is sensitive to penicillin. So if when they will give some medications, it will not affect him, it will not complicate his condition. So the conclusion, we can please do not hesitate to contact me if you have any queries regarding Mr. Oakes. Yours sincerely, registered nurse. I think it's clear for you, and just try to practice with the new case notes. There are lots of case notes available in YouTube or in Google. We can search also there, or in the official OET site you can find some sample questions and answers there. So please try to practice. All the best. Thank you.